you. So first, thanks, Marianne, for this full day dedicated to this key area of concern. And I think even more than ever, I think it's important on this topic to foster exchanges and data on science, create awareness and collaboration also. And you will see that it's true for neglected disease, and it's true also for some whole disease. Supposed to be well known as I will come on it. So before going into the details, just a brief disclaimer to mention that source, illustrations, references are from a visual story that was on yellow fever that was published by Devex in April this year, and that we sponsored, and you can find it easily on the web, just typing yellow fever visual story and Devex. So going now into the story, I think we all remember how far COVID impacted the world, impacted our own life. But long before COVID, a strange disease really swept across the planet, spreading to the Americas in the 15th and 16th centuries, and believed to be originated from the slave ships coming from Africa. And from there, many outbreaks occurred in the North America and also in the Arbor in Europe. So in the 18th and 19th century. And as an example, in Philadelphia, for example, there were an outbreak with more than 5,000 deaths, so around 10% of the population. And also in Europe, in Barcelona, I know we have lots of people from Barcelona today, there was a large outbreak with almost 20,000 deaths. So 1/6, I think, of the population of the city at that time. So really quite a large outbreak. And also the disease influenced also a lot the history. For example, the disease decimated the troops of Napoleon in Saint-Domingue, and finally it makes him really give up his plans to the Americas. So really fascinating history of this disease, and at that time it creates really a lot of mystery. What is this strange deadly disease with no cure, creating so impressive outbreaks? And again, yeah, the research around the disease is really fascinating for all the researchers that are online. And for example, there were some doctors that were lying during 7 days with the clothes and in the bed of sick people that were dead from the disease to try to understand. And so they concluded that it was non-contagious disease. And there were lots of studies to try to understand how it was transmitted. And we needed to wait for Carlos Findlay's hypothesis and also Walter Reed's research at the end of the 19th centuries and beginning of the 20th century to identify that this disease is transmitted by mosquitoes. So yellow fever, as I said, is a mosquito-borne viral disease. Initially, it was called black vomit. The symptoms include fever and nausea, but in extreme case, in fact, it can induce hemorrhage or bleed from the eyes, nose, and mouth. And the name yellow fever is coming from the jaundice and the yellowing of the eyes. The disease is mostly asymptomatic, but for the small proportion of yellow fever patients that develop these severe symptoms, half of them will die within 7 to 10 days. As I said, it's transmitted by the bites of infected mosquitoes, mainly from Aedes and Haemococcus species. And importantly also, this disease is a zoonose, so it's carried by primates, both humans but also non-humans, so monkeys, with 3 types of transmission cycles. A jungle or sylvatic cycle between monkeys in the forest, an intermediate cycle between monkeys and humans, and also urban cycle between humans only. And I think you will understand there why we're making the link between climate and this disease today. But before that, where are we today with yellow fever? So thanks to all the research findings on the vector and also on the viral nature of the disease, drastic mosquito control measures were put in place along with vaccination, because vaccine is available since the 1930s, and really all that helped to pause yellow fever's reign of terror that I was describing just before. However, yellow fever still circulates in several low and middle income countries. As of November 2022, 42 countries and regions were still at risk of the disease. And we estimate that 109,000 severe cases and 51,000 deaths each year, 90% in Africa. And we do think that these figures are really underestimated. Importantly for today's topic, what we observe is a re-emergence of the disease in the past 6 years with explosive outbreaks, including in areas where there were some preventive mass vaccination campaigns in the past. And this re-emergence is fueled by insufficient vaccination coverage, population growth, population movement, urbanization, but also climate factors, and let's deep dive in these climate factors. So as pretty well underlined by Paige, climate change is well known as a key driver for the ecology of mosquito vectors. Thinking about warmer temperatures, it will really help the development, the growth of vector, and even makes the reproduction cycle of the mosquitoes and also of the virus more fast. Thinking about the rainfalls that really favor the breeding sites for the eggs of the mosquito, and then can really increase the abundance of the mosquito vectors. So all that can really exacerbate the disease in the endemic area, but most importantly, it can make the vector expand to new areas where people are not yet exposed to the disease or not yet vaccinated. And this could be dramatic, because we could maybe observe again what I described in the past, when ships from Africa were coming to areas where the population was not exposed or not vaccinated yet, and induced quite large outbreaks, urban outbreaks. So the models predict that by 2050, nearly 500 million more people would be at risk for contracted mosquito-borne diseases like yellow fever, dengue, chikungunya, and Zika, that are transmitted by the same kind of mosquitoes. It predicts also yellow fever deaths across Africa that could increase by up to 25% in the worst case scenario. And last but not least, yellow fever mosquito vector could reach new temperate areas in the US and China, as far north as Chicago in the US and Shanghai in China. So again, it could be really dramatic, knowing the lethality of the disease during outbreaks in a urban area where the population is not yet immunized, either naturally or by vaccination, through vaccination, sorry. Of note, it's not just autumn weather, but also human behavior change that could expand the disease, that can cause, the expansion of the disease. Thinking about extreme weather events, it can cause social changes like mass displacement, causing thousands of climate refugees relocated from rural communities to major cities, and that could induce large urban outbreaks. Another environmental issue linked really to the nature of the disease itself, so the zoonose, is the deforestation. because in that case, people will go more often in the forest to work, will live closer also to the forest, and so will be more at risk to be bite by an infected mosquitoes infected by monkeys. So all that could really exacerbate the threats of yellow fever, along, as usual, with insufficient vaccination coverage. So there is, despite hard to predict variables, there is overall a consensus among experts that changes in weather and migration patterns will contribute to a higher burden of yellow fever in the future. So what should be done to get prepared to address this expected rising risk of yellow fever? Several strategies could be put in place and had already been initiated. A wider surveillance of the vectors, of course, and mosquito control activities. Development of technologies incorporated climate information into early warning systems for infectious disease predictions. And Chloe mentioned that in the previous session. Importantly also for yellow fever, as there is a vaccine. Vaccination is really a key driver, as one dose provides long life protection against the disease for most people. So for yellow fever, I know that there is a vaccine, so it's really a difference compared to other vector-borne diseases or mosquito-borne diseases. However, there is still lots to do to not reverse a century of health gain. So, for example, it would be really key to integrate this climate information in yellow fever vaccine long-term demand forecast to secure to have the appropriate amount of vaccine and the sustainable supply of vaccine. And also, importantly, partnership, cross-sector commitment from global institutions, governments, and industry will be key to increase vaccination coverage rates. To illustrate just there the power of collaborating approaches. More than 330 million people were protected against yellow fever in Africa since 2006, with almost 70% since the eye program inception in 2016. And for those that are not familiar with the eye, is that the global long-term strategy developed by WHO with core partner, mainly Gavi and UNICEF, to eliminate yellow fever epidemics. So I think this figure really illustrates the power of the collaborating approach and how it could boost the prevention on disease. Also, partnership will be key to support the innovation to really get prepared for future large unexpected outbreaks. Support innovation to improve diagnosis and surveillance, that would be really key for rapid detection of outbreaks. And also to develop probably new yellow fever vaccines, no more dependent on pathogen-free eggs, that can really improve the rapidity of response, securing stockpiling, improving emergency response to be really ready to tackle these potential future large unexpected outbreaks. And maybe just to hand few key takeaways that I wanted to pass to the group. Let's not underestimate how climate and also human behavior change could impact even all well-known diseases like yellow fever. And let's get prepared. All and each actor from the global health ecosystem has really a role to play to support partnership and innovation at all levels in order to avoid modeling data to become a reality.